Hormone replacement therapy is a controversial treatment.
Mm-hmm.
Exactly what is it?
So when women go through the transition from cycling, having the regular menstrual cycle, to not cycling anymore, their ovaries actually stop producing, for the most part, their estrogens and progesterones, their sex hormones. And production of those hormones actually transitions primarily to their adrenal glands. So these are the two little glands that sit on top of our kidneys, approximately right here under your rib cage. And
so we still get estrogen.
So you still get estrogens and you still get progesterones, but to a much lesser extent.
Okay.
For some women, it's a much lesser extent than others. And so hormone replacement therapy replaces those hormones that aren't being produced in as great a quantity as from their ovaries as prior to menopause. So it usually involves supplementation of progesterones and estrogens, sometimes just one or the other, sometimes different forms of estrogens, sometimes testosterone as well. But that's generally what hormone replacement therapy is.
But it became controversial because the Women's Health Initiative found that it caused heart disease and breast cancer in some of the people who participated in the study.
That's correct. And so it's become a much less used therapy actually since that initiative came out, simply for the risk of breast cancer. Adequate hormone levels are necessary for healthy, our mental health, for the way we feel, for muscle maintenance, and for actually bone as well. And so those are some of the reasons why hormone replacement therapy is still used for treatment of and prevention of osteoporosis.
What are some natural treatments?
Some of the more natural treatments that I certainly deal with quite a bit are use of bioidentical hormones. And so this is similar to hormone replacement therapy. I'd say it is a form of hormone replacement therapy. But rather than using chemical estrogens and progesterones that are based off of actually horse hormones.
That's right.
Yeah. These are actually identical, chemically identical to the estrogens and progesterones that your body produces. So typically women will have much fewer side effects on these bioidentical hormones in comparison with the more widely available hormone replacement therapy. So decreased side effects are a big reason people would choose to use those. Other things that certainly play into that hormonal shift health and making that transition smoother and decreasing your risk for osteoporosis, as well as increasing your body's actual hormone production, would include diet and lifestyle factors and the use of herbs. There are many herbs that can actually be used they're called phytoestrogens, meaning plant estrogens. They're not technically estrogens, but they act at estrogen receptors and can help with symptoms of hot flashes, vaginal dryness, other complaints that women often have with menopause. And so oftentimes that's a starting point, is first of all looking at what their hormone levels are. And if they need some kind of supplementation, starting out with phytoestrogens and other herbs that can help reset your body's hormone production.
And then you would go to the bioidentical?
And then if they're still needing something more, if we're not able to raise estrogen levels enough, or progesterone, and then looking at bioidentical hormone use too.
And does that require a prescription?
Not always. There are some over-the-counter creams and other things like that actually do contain bioidentical hormones and estrogens.
All right.
But there are certainly higher dose bioidentical hormones available as well.
But that's a lot safer.
Yes, yes. Your body actually recognizes those hormones and is able to process it much more easily through the liver. So the breakdown products of the hormones are not going to be as inflammatory, which is where you're getting side effects from. decreasing inflammation is part of cancer development. So although there isn't a huge body of research out there showing that the bioidentical hormones are not going to increase your risk for cancer, there's still the thought that if we're having fewer inflammatory side effects, that would seem to make sense that these aren't going to have the same potential for that kind of risk.
Thank you very much.